Let's put this into perspective. Over 589 million adults around the world are currently living with diabetes. That's 1 in 9 people. And guess what? Over 90% of those cases are type 2 diabetes. Now, even more concerning, nearly half of these people, about 252 million, don't even know they have it. That means millions are walking around with dangerously high blood sugar levels, completely unaware. Experts predict that by 2050, the global number could rise to over 850 million. That's almost 1 in every 8 adults. Diabetes isn't just about blood sugar, it's also one of the leading causes of heart attacks, strokes, kidney failure, and blindness. So, today's topic isn't just important, it's urgent. Hello, everyone. Welcome to today's live stream. My name is Diana, and today we're diving deep into a health topic that affects millions worldwide: type 2 diabetes. Specifically, as the title of this live video suggests, we're talking type 2 diabetes explained, causes, symptoms, and natural management tips. So, whether you're here to understand your diagnosis, you're here to support a loved one, or you just want to explore natural health solutions for diabetes, you're in the right place. Please, as you join me live or watch the replay, let me know in the chat where you're tuning in from and whether you have any questions as we go along. And I'll do my best to answer them toward the end or as soon as I see them. So let's make a start. What is diabetes? Diabetes is a chronic health condition that affects how our bodies turn food into energy. It all comes down to how we produce and use insulin, a hormone that's made by the pancreas that controls how much glucose is in your blood or our blood. Now, when we eat, carbohydrates are broken down into glucose or sugar, which enters the bloodstream. Insulin then acts like a key, allowing glucose into your cells to be used for energy. But in diabetes, this process doesn't work properly. Not having enough insulin in your blood or your body not being able to use insulin in the right way leads to having too much glucose in your blood, known as high blood sugar or hyperglycemia. So, what does diabetes do? Basically, it puts your heart health at risk because it damages your arteries, which are the blood vessels that carry blood to your organs. So, it's important that we make some lifestyle changes to reduce this risk and also to look after our hearts for many years to come. Now, whilst talking about diabetes, you may have heard the term pre-diabetes. Now, what is pre-diabetes? Pre-diabetes simply means that your blood sugar levels are higher than normal, but they are not high enough for a diabetes diagnosis. So, simply put, it's like your body waving a red flag. So, let's say you take a test and it shows that you don't have diabetes, but your doctor says you have pre-diabetes. What this means is that if you don't change some of your habits now, you have a high risk of developing diabetes and damaging your long term health. If left unmanaged, prediabetes often progresses to full blown type 2 diabetes. But the good news is that it is reversible with lifestyle changes. So, my advice would be get your HbA1c levels checked if you're at risk, especially if you're overweight, you're inactive, or you have a family history of diabetes. Now, what does HbA1c means? HbA1c stands for glycated hemoglobin. It's a blood test that shows your average blood sugar levels over the past 2 to 3 months. So, when sugar or glucose circulates in your blood, usually it sticks to a protein in your red blood cells called hemoglobin. Now, the more sugar in your blood, the more it gets glycated. So, why is this test important? Unlike the daily fingerprint prick tests that show your blood sugar at one moment, the HbA1c test gives like a bigger picture, which is why it's usually used to diagnose pre-diabetes or diabetes. It's also used to monitor long-term blood sugar control, and it's also useful in assessing how well treatment is working. Now, let's go into the types of diabetes. Now, there are three main types of diabetes which you may have heard or you are familiar with. We have type 1 diabetes. Now, type 1 diabetes is an autoimmune condition where the body attacks insulin producing cells. Hence, your body does not make insulin. And 1 in 10 people with diabetes are type 1. And also, children and young adults are more likely to be diagnosed with type 1 diabetes. Also, we have type 2 diabetes, which is caused by insulin resistance or reduced insulin production. Simply put, your body does not make enough insulin, or your body cannot use the insulin that it makes. Now, 9 out of 10 people with diabetes have type 2, and then people are more likely to develop this type of diabetes as they grow older. The third type of diabetes is gestational diabetes. This type occurs during pregnancy and usually resolves after birth. Today, however, our focus is on type 2 diabetes, which is the most common form and also is often linked to lifestyle factors. Now, what happens in type 2 diabetes? Type 2 diabetes happens when your body becomes insulin resistant. So, meaning that your cells don't respond properly to insulin, or your pancreas can't make enough of insulin. Now, as a result, your blood sugar builds up in the bloodstream, and that's why type 2 diabetes is often called the silent killer, because symptoms develop gradually and can often be missed until complications arise. Now, like I mentioned earlier on, insulin is produced by the pancreas, which plays a very important role in our bodies. After we eat, we begin to digest foods containing carbohydrates, breaking them down into glucose. In people who don't have diabetes, insulin is released when they eat. It acts as a signal for cells around their body to absorb the glucose and to use it as fuel for energy. But in people with type 2 diabetes, their bodies don't make enough of insulin, or it can't use the insulin that it makes. So it's almost as if they have a weak signal. Their bodies don't respond to the insulin as it should, and then the cells don't absorb enough of the glucose. This is what we mean by insulin resistance, and it often results in high levels of glucose in their bloodstream. Now, high levels of glucose in the bloodstream for a long period of time can damage the arteries and can also increase the risk of heart and circulatory diseases. So, how does diabetes affect the heart and the blood vessels? Uncontrolled diabetes damages the blood vessels and increases the risk of heart attacks, increases the risk of stroke, it increases the risk of high blood pressure, peripheral artery disease, and lots more. Now, the longer your blood sugar is high, the more damage it causes to your cardiovascular system. The buildup of too much glucose in the bloodstream damages your arteries, and then this damage to your arteries now makes it easier for fatty deposits to build up. Now, if the arteries that carry blood to your heart get damaged and clogged, it can lead to a heart attack. If this happens in the arteries that carry blood to your brain, it can lead to a stroke. And then diabetes can also cause a range of so many other problems over time, as well as harming your heart and your blood vessels. Diabetes can also affect other parts of your body. For example, people with diabetes are 2 to 4 times more likely to die from heart disease than those without diabetes. Diabetes also affects your brain. So people with diabetes are 2 to 3 times more likely to develop vascular dementia due to blood vessels becoming damaged. Diabetes can also affect the blood vessels in your eyes, leading to problems with eyesight. This is called retinopathy and can cause blindness. Our kidneys are not left out. Diabetes can damage the small blood vessels in our kidneys so that our kidneys begin to work less well at getting toxins out of our bodies. This is called nephropathy. Now, men may also experience erectile dysfunction, and women may experience a decrease in sexual desire, pain during sex, or inability to reach orgasm. Diabetes can also affect the nerves. Damage to your nerves can lead to a loss of sensation, can lead to pain, can lead to numbness or tingling in the hands, legs, and feet. This is called peripheral neuropathy. Now, there may also be problems with your circulation that can lead to ulcers on your toes and lower limbs. And if these issues are not treated over a long period of time, they can result in amputation of the affected limbs. This is why it is so important to have an annual check to monitor your health and to look out for these signs and symptoms. Next, let's explore the risk factors for diabetes. So, who gets diabetes? Now, some major risk factors for developing type 2 diabetes include being overweight, especially abdominal fat. That is to say, you carry weight around your middle. Inactivity, family history of diabetes, high blood pressure or cholesterol, advanced age. So the risk for diabetes increases after 45. Poor diet. So for people who have a diet that is high in sugar and processed carbs. Now, there are lots of symptoms that are associated with diabetes, which, if you notice, you should not ignore, because it's not always easy to tell if you have diabetes. Different people get different symptoms at various times, and these symptoms can develop slowly. Many people with type 2 diabetes usually don't even know that they have it. Now, you may have diabetes if you're often very thirsty, um, if you're peeing more than usual, particularly at night, if you're often very tired, dealing with fatigue, it may be a sign of diabetes. If you have blurred vision, if you experience tingling in your hands or feet, if you notice that you're losing weight unexpectedly or you have unexplained weight loss, it could also be a sign. If you notice that your cuts or your wounds heal slowly, it could also be a sign. If you're having genital itching or regular episodes of recurring infections such as yeast infections or UTIs, urinary tract infections. So if you show any of these symptoms that I've just mentioned, please do not ignore them. Your doctor can diagnose you, help you manage your condition, and stop things from getting worse. Now, moving on, let's briefly recap how insulin resistance develops. Let's expand a little bit on how insulin resistance develops. Now, insulin resistance develops when your cells stop responding to insulin. Now, to compensate for this, the pancreas then makes more insulin until it can no longer keep up. Now, over time, this leads to chronic high blood sugar and eventually leads to up to type 2 diabetes. Now, let me give you a simple analogy. Imagine insulin as a key and your cells as locked doors. Now, in insulin resistance, the key stops working and sugar stays in the blood. Now, how do we manage type 2 diabetes? um, Management of type 2 diabetes is basically consistency plus awareness. So, people with that type 2 diabetes can improve their health and reduce their risk of heart and circulatory diseases by making simple changes, simple lifestyle changes. So if you have type 2 diabetes or you are at risk of type 2 diabetes, you can improve your health by first and foremost losing weight if you're overweight or if you carry weight around your middle. You can also do that by being more active, by giving up smoking, and so many more. Now, being a healthy weight is an important way to protect yourself from heart and circulatory diseases. It's also an important way to prevent yourself from developing diabetes and diabetes related complications later on in life. So, what are some key areas that you would need to focus on? First and foremost, monitor your blood sugar levels regularly. Secondly, eat a healthier, balanced, low GI diet. Now, healthy eating for weight loss does not necessarily mean counting calories or cutting out food groups. It actually means eating more of the foods that are good for you, such as fruits, vegetables, and whole grains, and then less of foods and drinks that are high in fat and sugar. For example, you can swap full fat milk for semi skimmed milk. You can replace chocolates with fresh fruits. You can try halving the amount of sugar you use in your tea or coffee and gradually decrease from there. Or you can try herbal fruit teas. You can also try replacing ice cream with natural yogurt and fruit. Also important that you get your portion sizes right. So it's important to eat the right amount of food. However, if your portion sizes are too big, your weight and your blood glucose control will be harder to manage. It will also stop or slow down weight loss, which is often part of managing diabetes. So, using your hands is an easy way to measure food portions, and also eating off larger plates and bowls can make you eat more than you need to. So it's advisable that you use smaller plates whenever you can. So let's say you want to eat carbohydrates like pasta, rice, or potatoes. Your portions should be the size of your fist. Now, if you're eating things like meat and beans, this could be the size and width of your whole hand. Now, let's say you want to have chicken or fish. A portion of chicken or fish could be the size of your whole hand as well. And then if you're having butter, you could consider a portion to be the size of your fingertip. And if you're having things like cheese, it should be like less than the length and depth of two fingers. Lastly, let's say you're having fruit. A fruit portion should sit in the palm of one hand, while vegetables should sit across both hands. Now, it's also important that you cut back on sugar. Eating less sugar can help keep your blood glucose levels under control and keep your weight in check. The sugar that is found naturally in fruits, in vegetables, and dairy foods or dairy products is good for us. It's actually the added sugar in foods that we need to cut down on. Now, remember that sugar isn't just in foods that taste sweet, like chocolate, cake, or sweetened drinks. Sugar is also hidden in so many foods, including our breakfast cereals, pasta or curry sauces, tomato sauce like ketchup, baked beans, low fat yogurt, takeaways, and ready or frozen meals. So, the other thing that you need to know about sugar is that sugar comes with many different names. So, you could hear names like syrup, glucose, dextrose, sucrose, and even honey. They are all types of sugars. That's why it's important that you look at the labels on the foods that you buy. Unfortunately, no one type of sugar is better for you than the other. All added sugars mean the same thing for your body. Um, Next is to stay physically active. So, being more active will help keep your glucose in check. It will reduce your risk of heart and circulatory diseases, and it will also help manage your weight. Now, another thing being active does is that it helps you use the insulin that you have in your bloodstream. It helps you use it better, and it also helps your cells to use glucose. Overall, this will help to decrease your blood sugar levels. So, aim to do about 150 minutes of exercise a week. That comes down to about 20 to 30 minutes a day. Make sure that each burst of exercise that is at least 10 minutes or more. It could be fast walking, it could be cycling, it could even be climbing stairs a few times. All of these count. Basically, anything that makes you breathe a bit harder and feel warmer will help. Now, if you're on medications already for type 2 diabetes, such as metformin, please continue to take your medications as prescribed. And then also, it's important that you track your HbA1c levels and aim for this to be less than 7%. Now, one of the most important numbers to keep track of if you have diabetes is your HbA1c levels. And ideally, you want to aim for under 7%. Like I mentioned earlier, HbA1c is a blood test that tells you what your average blood sugar level over the last 2 to 3 months is. Now, it gives a big picture view of how well you're managing your diabetes. So it's not just one reading like a finger prick, it's like your overall control. Now, why do we say that you aim for below 7%? Because keeping your HbA1c in that target range lowers your risk of serious complications like nerve damage, kidney failure, and heart disease. So, most healthcare providers recommend that you check your HbA1c levels every 3 to 6 months, depending on how stable your blood sugar has been. Think of it like your diabetes report card. Tracking it regularly keeps you informed and in control. Now, you may be wondering, are there any natural remedies or any more lifestyle changes you can make? Yeah, the answer is yes. Um, Many people want to manage their diabetes naturally, and I've got a few evidence based strategies to share. So some of the natural remedies that you could try is cinnamon. Cinnamon can help to improve insulin sensitivity. Now, we also have berberine, which is a plant compound shown to lower blood sugar. Another natural remedy that you can try is apple cider vinegar, and research shows that it can help to reduce post-meal glucose spikes. Fenugreek seeds is another one that is has been shown to improve glucose control. In terms of lifestyle changes, try to lose 5 to 10% of your body weight. Try to take walks after your meals. It's important that you get at least 7 to 9 hours of quality sleep every night. And then you can also practice stress management. So it could be yoga, it could be mindfulness, anything that helps to keep your stress levels under check has also been proven to be helpful. Now, a quick disclaimer, please. Always speak to a healthcare provider before starting any herbal supplements or any of these natural remedies that I have mentioned. Now, at this point, if you haven't already and you have any questions, please drop them in the chat and I'll try to answer any burning questions you have about diabetes, your diet, and natural health. Now, as we begin to round up, let's recap what we have covered. We covered what diabetes is, we covered what pre-diabetes is, we talked about the types of diabetes, we focused on type 2 diabetes and how it links to heart and circulatory diseases. We talked about the symptoms and risks of diabetes, how insulin resistance happens. We talked about some management strategies to help keep your diabetes, your type 2 diabetes in control. And then we also talked about some natural remedies that you can try. So, if you found this video useful, please give it a thumbs up. Please share it with someone who needs to hear this, who needs this information to help with their diabetes, whether they've got a diagnosis or they're at risk of having diabetes. And also, don't forget to subscribe to this channel for more nursing, mental health awareness, and general health and wellness content every week. Thank you so much for watching, and until next time, take care.